Hi everybody. In the last several videos we've been talking about Dr. Bredesen's RECODE protocol for reversal of cognitive decline, which has been a crucial program for my dad. Dr. Bredesen's team has helped hundreds of people reverse their cognitive decline, establish mild cognitive impairment, and Alzheimer's disease with this protocol as evidenced in successful studies in 2014, 2016, 2018, 2022, and current clinical trials. Today we're continuing on with the Cognoscopy, Dr. Bredesen's diagnostic framework for screening all the potential contributors and risk factors for cognitive decline. All these tests and lab results paint a clear picture of where a patient stands and helps identify how they got there. It is the foundation for an individualized protocol to be built out for prevention or reversal. On the last episode, we specifically talked about the very important lab marker, LDL cholesterol. Next up, we're coming over to triglycerides. So, what are triglycerides? Well, let's recap our last several videos on cholesterol. Cholesterol is an essential lipid, a fatty substance our bodies need for building cell membranes, making hormones, and vitamin D. It also plays a crucial role in brain development, function, and overall health. It is a vital component of cell membranes, influencing neuronal structure, signaling, neurotransmission, and is essential for myelin and synapse formation. And even though cholesterol has been vilified for decades via the lipid hypothesis, high cholesterol itself is not the problem as much as it is when present in conjunction with insulin resistance. If you remember, the total cholesterol blood test measures the sum of HDL cholesterol, LDL cholesterol, and 20% of triglycerides in the blood. For more in-depth breakdowns on total cholesterol, HDL, and LDL cholesterol lab tests, please check out episodes 101, 103, and 108. Okay, so what are triglycerides? Triglycerides are a type of fat or lipid found in our blood that is different from cholesterol. While cholesterol is used to build cells and certain hormones, triglycerides store unused calories and provide our bodies with energy. When we eat, our bodies convert any calories they don't need to use right away into triglycerides. They are then stored in our fat cells. Later, hormones release triglycerides for energy between meals. If we regularly eat more calories than we burn, particularly from high sugar and carbohydrate foods, we often develop high triglycerides. Your doctor will usually check for high triglycerides as part of the total cholesterol test, which is sometimes called the lipid panel, and it's typically done in a fasted state for an accurate measurement. According to the Mayo Clinic, standard of care's ranges for triglyceride lab values are as follows. Normal, less than 150 milligrams per deciliter. Borderline high, 150 to 199 milligrams per deciliter. High, 200 to 499 milligrams per deciliter, and very high, 500 milligrams per deciliter or above. Why this matters is because high triglycerides can contribute to hardening of the arteries or thickening of the artery walls, which increases the risk of stroke, heart attack, heart disease, as well as cognitive decline. High triglycerides are often a sign of other conditions that increase the risk of heart disease and stroke, including obesity, metabolic syndrome and dysfunction, type 2 diabetes or prediabetes, and hypothyroidism. Although standard of care views anything less than 150 milligrams per deciliter to be normal, Dr. Bredesen's team has typically seen levels between 50 and 100 milligrams per deciliter to be associated with improved cognitive health and function. This range will typically point to better metabolic health. Better metabolic health will usually drive better cognitive health. Anything above these levels is typically accompanied and driven by insulin resistance, obesity, sedentary lifestyles, and poor sleep quality. All these are not great for the brain. Dr. Bredesen has found that insulin resistance is the single most important metabolic contributor to Alzheimer's disease development and progression, and that the biggest drivers of insulin resistance for us are diets high in simple carbohydrates, such as sugar, processed food full of high fructose corn syrup, sedentary lifestyles, poor sleep, and chronic stress from work and home lives. But he also found that the antidote to reversing insulin resistance, restoring insulin sensitivity, and improving cognitive function was optimizing the right diet, exercise, sleep, and stress management programs within patients' protocols. These are the core pillars of the RECODE protocol. Diet is undoubtedly the most important factor in optimizing triglyceride levels. Please check out episode 16 for a brief overview of Dr. Bredesen's anti-Alzheimer's diet, KetoFlex 12-3. And if you're asking, how do I get tested for these labs to assess my Alzheimer's risk? Check out Dr. Bredesen's website and episode 12, both linked in the description box below for more information. And I'd love to hear from you. Has your neurologist ever spoken to you about your triglyceride levels? What do you think of this video? Please drop me a comment. If you found this information helpful, please feel free to share this video with anyone you think it could serve, and please like and subscribe as it helps our community grow. And remember, I'm not a doctor. I don't have a PhD. I'm a caregiver and citizen researcher on the ground, helping a loved one, someone just like you. This information is for educational purposes only. Please consult your medical practitioner before implementing any changes. Thank you for watching. My dad thanks you. Hope these resources are helpful to you and your family, and see you in the next video. Thanks.